Now, more than 4 years ago, questions were being raised both in New Zealand and internationally about the safety and long-term use of puberty blockers to treat children experiencing sex-related distress. Yesterday, the Ministry of Health announced it had been instructed by the government to consult on whether there should be additional safety measures around prescribing these drugs to children and adolescents to treat gender incongruence. The ministry published its evidence brief and position statement on puberty blockers that says the evidence review found a lack of good quality evidence for the effectiveness or safety of puberty blocking treatment in young people with gender dysphoria. We do not have good evidence to say that the medicines used improve the longer-term outcomes for young people with gender-related health needs, nor that the potential longer-term risks are low. In April this year, CAS released its final report. It was an independent UK report that took 4 years to complete. It is the most scientific review of the evidence for treatments for gender questioning and gender distress to young people ever undertaken. The CAS report recommended a pause in prescribing blockers in light of the short and long-term side effects, including menopausal symptoms, weaker bone density, and the potential impact on fertility, sexual function, and brain development. The CAS report found that the existing studies were of poor quality and lacked evidence on the long-term impact of taking hormones from an early age. CAS concluded that the research has let all those involved down, and most importantly, children and young people. Far from giving children time to think, the CAS report found that puberty blockers effectively locked them into a medical pathway, leading to cross-sex hormones and surgeries that are irreversible. Back here in New Zealand, Dr. Joe Bourne is the Chief Medical Officer at Ministry of Health, and he joins me now. Dr. Bourne, good morning.
Good morning. Nice to be able to speak to you.
Yes, thank you. And I appreciate your time this morning, Joe. The Ministry completed an evidence brief in September last year. It was due out in February. Why the delay?
It's a good question. I think what was happening is, you'll know that you've mentioned the CAS report yourself. That got published when we were looking to publish our own review. And because of the size of that report and other evidence that was coming, we felt it was appropriate to consider that, to look across the world at what other jurisdictions were doing, and make sure that when we released our evidence brief and our position statement, it was really appropriate for our context here in New Zealand.
All right, so you looked at other international papers, I assume that, and you looked at clinical outcomes around the world, and as you just mentioned, you looked into the CAS report as well.
Yeah, absolutely. So I think we've done a very thorough piece of work. It did involve us going back and looking at the evidence again, and we continue to monitor it because this is a developing area.
What are the new rules the Ministry of Health is implementing immediately, Joe?
Well, what we're really focused on is ensuring that all young people are able to access the care that they need. So within this particular area, we're focused on ensuring that puberty blockers aren't the destination for young people at all. Actually, they have broad health needs that are medical, but they're also social and mental health needs as well. So we want to ensure that young people can access all of those different services, that their care is from an interprofessional team, and that any prescribers are really experienced of working in this field. The other thing that we need to make sure that young people and their families' caregivers are aware of is that lack of evidence that exists, both for the potential benefits and for potential harms. The only harm that there's good evidence that it does exist is around bone density. But the other parts, there's neither evidence for or against some of the other consequences that people have suggested may be associated with puberty blockers.
So, I mean, explain this to me. I'm not really hearing there's a big change then. Are you restricting the prescribing of puberty blockers then?
So this is a significant change because what it looks at is the standards that are set for all clinicians. Now, our context in New Zealand is quite different from the UK, and so we have a number of different services across the country, and we're confident that on the whole those services do take this precautionary approach, and that young people are getting all of the services they need. But what we're doing now is setting a really clear standard against which clinicians will be held accountable.
So hang on. So clinicians can still continue what they're doing, but they've just got to now be more precautionary. That's really it. It's up to them whether they want to. Now they've just got to be taking a precautionary approach.
Well, this shouldn't be about a single clinician. This is about a team of clinicians that are around a patient, and they should ensure that anybody who there may be a benefit from using these medications are really clear that the evidence that we have in this area is not good. It's poor evidence, and so it's really about ensuring that anyone that is prescribed them is making an informed decision on whether to take them or not.
So up until now, Joe, what were they being told then if they weren't given any informed information?
Well, the conversations that we've had with clinicians is that they have been given this information, and what we're really doing is we're reacting to a concern across the world. So other jurisdictions have had more concerns about what their services were like, and it's not for me to make comment on the quality of their services. But in what we're doing in New Zealand now is we're ensuring that we've got this safeguard in place, so those standards are really clear. Other countries like Australia and most of Canada continue to make these medications available. So it's not a blanket ban across all countries, and we're just making sure our settings are right here in New Zealand, and we have the advantage of now going through a consultation process so we can see if any additional precautions are needed.
Well, no, I realise other countries have looked into this, and they seem to be a little bit more ahead of us, Joe, because you mentioned Australia, but there are limitations for use of puberty blockers in UK, Finland, France, Norway, Sweden. England's National Health Service have stopped prescribing puberty blockers. So why aren't we just banning them?
Well, because we're looking at the systems the settings that are appropriate here in New Zealand, and we're going to go through a process which allows us to consult with the public, and particularly we're looking to consult with people who are affected in this area to understand whether we need more formal regulations.
I mean, you said you looked into the CAS report, and basically they found that it locks these young people into a medical pathway leading to cross-sex hormones and surgeries that are irreversible. You mentioned bone density, weaker bone density, potential impact on fertility, sexual function and brain development is all in there as well. Does that not just say that we should not be giving them to children?
Well, the main thing to pick out around the evidence is that we don't have good evidence that shows any of those other side effects. The only evidence is around bone density. And when we look at that, we don't actually know whether that causes an increase in fractures in the future. But what we do know about the situation in England, and when Dr. Cass talks about people being locked into a system, that was very much connected with a service that was provided out of a single clinic who were managing huge demand, and their reflection was that once people started a pathway, there was not enough time and effort spent reviewing that and ensuring that what the care provided was what a young person wanted. We don't have that situation here in New Zealand, and that's why we've taken the approach we've come to now, and that we're considering whether further precautions are needed. But we feel that the standards that are being set now are very clear, and we have confidence that at this point will ensure that young people are getting the right care that they need, because ultimately it's that meeting their needs.